Welcome to Coffee and Conversation, AI in Healthcare. I'm Jen Hand, and we are here today with Dr. Colin Bonas, Chief Medical Officer at Dr. First, who's not just an experienced internal medicine hospitalist, but also a trailblazer in healthcare IT. From advocating in front of the U.S. Senate to leading digital innovations in medicine, Dr. Bonas is transforming patient care with big data and real-time solutions. Thanks for being here.
Thanks for having me, Jen.
Yeah, we're excited to dive in with you. So I'd love to start off with your rich experience in internal medicine and healthcare IT, because I think it's a unique background. How do you envision AI and big data shaping the future of patient care, particularly in enhancing outcomes and decision-making?
Oh man, so that's the billion-dollar question right now, isn't it? I think, so as you alluded to, I've been in the healthcare and the IT intersection at the point of patient care. I've been doing this for 2 decades. So all the way from training and documenting on paper records to helping lead the transition to electronic medical records and to the complete digitization that we're finally experiencing now. And of course, you can't go anywhere these days without tripping over AI. It's at every trade show, it's in every publication. It's even made it all the way out to the non-healthcare publications as it relates to the impact on health IT. And it's getting confusing to separate what's true from what's hype. But to your original question, where do I think we are going with this? I think, and I've said this before, I think that in 5 years we'll ask ourselves as an industry how we ever practiced medicine, healthcare without augmented intelligence. That's another thing I like to point out is I am not a fan of the term artificial intelligence. I'd much rather say augmented intelligence, because I think the proper role for AI technology is as an assistant, not a replacement, as a co-pilot in your clinical care. I do think that the other quote that I'm fond of saying, and some of my colleagues are fond of saying, is that we might be overestimating the impact that AI is going to have in the short term, in the next 2 to 3 years, but we're probably underestimating the impact that it's going to have in 10 years from now. And I truly believe that. So your question really honed in on decision making. And that's the part that's not quite as clear to me right now. Where you do see a lot of applications for AI in healthcare is around administrative burden. You're using the AI to help sift through large amounts of data and condense it. You're using large language models to help craft responses to insurance agencies or to patients as a jump start. Knowing all the while that someone's a human is going to be in the loop to make sure that the content created is accurate. We're just now really dipping our toes into what you alluded to, which is the decision support side of it, which is the algorithm doing things that humans can't do on at a much faster rate and a bigger scale, to suggest different interventions, to suggest different studies that I should be considering as a physician caring for you. And so right now we're in that administrative burden portion of AI really solving something, and we're shifting into what you were talking about, which is the decision support portion of it.
I think it's important to pull out one thing that you said around, in 5 years we'll wonder how we practice medicine without it. I think that's such an interesting prediction, and really true, because if you think 5 years ago to things that we now just take for granted, even in day-to-day life, something as simple as Siri or Google Maps, we can't envision life without. What do we do before that? And it's really fascinating to think about, well, what will happen in medicine in 5 years when we look back and say, wow, this tool, well, what did I do before that? So I love that. I love that thought line, because then taking that further, it's even like, okay, in 10 years, if we're underestimating where we'll be in 10 years, I mean, can you even imagine where we'll be when we say in 10 years, we'll look back and say, wow, we couldn't do without XYZ.
Yeah, I mean, think about it. The iPhone, just to pick some form of technology, what, 07, or the iPhone might be 15 years old. We're on iPhone 15 or 16 right now. So fast forward 10 years from, can you imagine doing anything without your device?
No.
Right. So imagine where, like you said, where could we possibly be in 5 to 10 years as it relates to technology? I always consider myself in a unique position in that I was able to experience healthcare on paper, and I had a pager, and I remember my first cell phone, and it wasn't when I was in high school. It was much, much later. And so I think I do have some perspective on how things used to be and how much better they are now. And so that's why you get excited when it comes to informatics and to health IT at the point of patient care. You see a lot of negative stories, right? The EHR is adding burden. Our doctors, our nurses, our frontline is all burned out because of all this administrative tasks that we've placed on them because of the EHR. Yes and no. I mean, it wasn't much better on paper either. It's easy to point at the thing that's bothering you right now instead of having perspective about how far we've come. And so, back to the original point, I have high hopes for AI and also in all forms of technology to make the patient care experience delightful, not only for the patient, but also for the providers.
Yeah, for both parties, absolutely. And I know you mentioned AI being all the buzz in event season and at trade shows and whatnot. I think one other big theme that I always hear is interoperability. And I think the pace of progress in interoperability that's often criticized in healthcare for not being fast enough, especially from the patient perspective. I'd love to hear what strategies you think are essential to accelerate that adoption of inoperable healthcare systems to sort of get to that vision, 10 years down the line where everything is interconnected and seamlessly working.
Yeah, it's unfortunate. So I get to play both sides of the coin on this in that I also agree it's not fast enough. I think we've been talking about interop since the meaningful use days. So, go back to 2010 when we had a whole bucket of money that we were going to incentivize providers and hospitals to make their records digital. One of the overriding promises of that was it's all going to be interoperable. All these systems are going to talk to each other. You're not going to be filling out paper forms and using fax machines. And it's almost 15 years later, we're still using fax machines. That being said, for those of us who follow the industry like yourself, TEFCA is finally making progress. The QHINs, there are folks that are onboarding with this new idea of federated interoperability among health systems. We have made lots of progress with things like direct messaging and CCD exchange. And so it's not necessarily the nirvana that you and I expect, not only as patients, but also as consumers, because you look at the experience you have in other industries, whether it's telephones, whether it's airlines or your shopping experience or banking experience. All of those things are so seamlessly interconnected that we don't even think about it anymore. Whereas healthcare is still really struggling. We're getting good at moving some pieces of data from point A to point B, but it's not necessarily the data that I need. It's not necessarily in the format that I can use readily. And so this is where it's interesting, and this is why I said I get to play both sides of the coin, is that, when the public, when industry doesn't solve these problems by themselves, you see the hand of the government coming in to sort of guide us along. And so that's where you've seen a little bit more momentum in the form of TEFCA and QHINs. And now you've seen ONC regulations related to interoperability between payers. So things like prior authorization, things like individual access records. So your ability as a patient to have a seamless access to at least portions of your digital record in the format of your choosing. And so it's getting there. It's getting there, but it's just not fast enough. And I do think, aside from the hand of government incentivizing and then eventually mandating some of these exchanges, I also think that the slow but inevitable shift towards payment reform, whether that's value-based care or risk-based models, in order to be successful at those types of models, you need data. and you need interoperability among your community partners. This is not something you can typically go alone unless you're a massive monolithic entity like a Kaiser, for example, where you sort of own the entire thing from end to end. And so as the industry shifts, as you follow the money, you're going to have to get good at interop if you want to be successful. And so, in summary, it's getting there. It's not fast enough, but it's a lot faster than it was 10 years ago.
Yeah, and I do think the buzz around talk in the industry at events and sessions and things, people are realizing we need to collaborate, we need to partner, we need to all work together rather than everyone pursuing their own separate solutions. So yeah, I mean, I 100% agree. And I think I always love hearing about AI is, of course, what everyone is interested in, and of course myself as well, but I love hearing about interoperability because I think it's somewhere that has the most to benefit from for future advancements.
Yeah, it's kind of like what's shiny and sexy and what's like foundational, right? And
Yeah.
and interoperability really needs to be viewed as something as a foundational requirement. It doesn't mean you can't chase the shiny things and dabble, but if we had put as much focus on interop as we put on, Chat GPT and LLM in the last 2 years, we probably would have solved it by
Yeah.
now.
That's a good point. So let's talk a little bit about your efforts in spearheading VCU's Open Notes initiative. So that's where patients have access to their clinical documentation in real time. And I know you're a strong advocate for transparency in patient health information. So how do you think that this transparency impacts patient care and the patient involvement in their own journey?
Yeah, and so that's a role from my former my former career as a CMIO. And fortunately, the Open Notes the idea of giving full transparency to the entirety of the record to the patient, it's not nearly as novel now as it was, 7, 8 years ago when I helped spearhead that on behalf of our patient population. But I do think transparency is going to be one of the differentiators for health systems, for AI models, for a lot of things in health IT going forward. I don't think we're going to have the benefit of being a black box on behalf of our patients going forward. I think patients are going to start to vote with their feet regarding the experiences that they have at their various healthcare providers. And one of the keys to a great experience is transparency. And so, anecdotally, and actually the literature will back this up as well, giving patients access to their records, the full note, the actual clinical note from me seeing my primary care doctor, it doesn't lead to increased phone calls or anxiety. If anything, it actually improves patient satisfaction. It improves their ability to adhere to care plans because now they have something that they can reference and say, oh, doctor told me to do X, Y, and Z. And also we have multiple examples of patients actually catching things in their own record and then surfacing them to an appropriate provider that actually made a big difference. Hey doctor, what's this nodule that they mentioned on the chest CT? Oh, holy cow, you need a repeat chest CT. This could be actually, and so why not allow the patient to participate in their own care? I think it's a little bit paternalistic to say, oh, they're not going to understand that, or that that's not for them. It absolutely is for them. It's their record. It's their health. And so I was very proud to spearhead that, as I mentioned 6, 7 years ago. And I do think, going back to your interoperability question earlier, that's the sort of thing that patients are getting more and more involved with as it relates to individual access services and their ability to access their records, and then also make them portable, send it to a caregiver, send it to another healthcare provider. And not fast enough, but it's getting there. Yeah.
It's never fast enough, but I think that's a great point about the engagement of a patient in their own journey. If you can look at your notes and maybe reread it, digest it, take a look at something else, ask for another opinion. I mean, it has a huge impact on how much we feel empowered to continue that care in that journey, seeing specialists, getting another opinion, et cetera. So yeah, it's great that 6-7 years ago it was a new sort of initiative, and now it's just more and more normal. So that's kudos to you.
No, thank you.
So we'll wrap up with looking at costly claims, which I know from a patient perspective and of course health plan perspective is a significant issue. But reducing costly claims from prescriptions is a big issue for healthcare. So what are your thoughts on how we can leverage AI to assist healthcare providers in identifying more cost-effective medication options for their patients?
Oh, wow. So this is one of the sweet spots for Dr. First as a company. So Dr. First is the core mantra of the company is around the intelligent medication management. So from prescribing, to assisting prescribers all the way to patients getting on and staying on therapy, we like to think that we have interventions and touch points all throughout that ecosystem. And so, back to our comment around transparency, how can we leverage this technology, whether it's AI, whether it's evidence-based decision support? How can I surface insights at the exact moment that I need to in order to influence appropriate change? And so, think about prescribing. On the prescribing side, I have you in front of me. I'm going to write you for the latest, GLP-1 or whatnot, whatever the new drug is. And the technology surfaces and says, well, actually, that's not covered by this person's plan, or it is covered, but the copay's $1,500. But here's an alternative that might be on formulary, and it's $50 or $100. Well, now I can have a conversation with you and say, what's your ability to afford, drug A, and what do you think about drug? We can participate together. It's a back and forth rather than traditionally it would be fire and forget. Like I'd write you the drug, I'd send it off to CVS, the patient would show up and not be able to afford it. And I would have no insight into that until 6 months later when they came back, and sure enough, their condition hasn't changed because they never started their therapy. And so, in a similar vein of surfacing insights for providers, how can I surface the same thing for the patient? How can I match the patient up with appropriate education, with appropriate savings opportunities, whether it's copay assist or coupons? And how can I use the technologies, something as simple as SMS, via the phone, to engage with the patient to say, hey, don't forget your medication, or here's some education about your medication. And we've actually had these technologies that have proven, sometimes upwards of 10% improvement in patient adherence, which is actually massive. If you start to get a 10% lift in a lot of these chronic medication adherence rates, that translates into big savings in the form of readmissions or comorbidities down the line. What's really exciting is how can we further leverage AI or technology to remove other friction points in the medication journey? And particularly, I think of things like prior authorization, understanding at the moment of care, are you going to need a prior auth? Can I automate this in some capacity? Can I empower you to take part of some of this so that we can both be aligned in the journey? Because right now it's very fragmented. Patient shows up to the pharmacy. They didn't realize a prior auth was required. Now they're trying to get me via fax. Then the patient calls, but there's just, it's kind of bonkers in the year 2024 that this is where we still are for something as important as drug therapy. But now we have new technologies in the form of augmented intelligence that I really love the idea of using AI to sand down the friction in care events. And so really excited for Dr. First to be a part of that. A lot of new developments on the horizon in that realm. And as I said, that really is the sweet spot for the company.
Yeah, I just want to point out, I think it's the first time we've had a guest say bonkers on our series, so I love it. And I think that speaks to that the prescriptions and the cost saving speaks to the, kind of coming full circle to your first answer around having augmented reality, or excuse me, augmented intelligence assist, leverage it. It's not replacing anyone. Like that is, it's an empowering tool. It's a cost savings tool. It's a removing friction tool. So yeah, I
Yeah.
think it's just coming full circle to say that what you guys are doing at Dr. First, amazing work, and you know, huge potential for cost savings for all parties. So
Yeah.
thank you so much for sharing your insights. We appreciate it, and we will link to your LinkedIn and of course Dr. First. So thanks for being on the show.
Hey, thanks, Jen. I appreciate it.